Taiwan Centers for Disease Control says the winter's flu outbreak has reached epidemic proportions 2 weeks earlier than expected. Last week, the nation's residents made more than 100,000 hospital visits for flu-associated symptoms. There were 55 cases of serious complications, including 5 deaths. Officials advise at-risk groups like young children and the elderly to get vaccinated before mid-January. The current outbreak is expected to peak around the Lunar New Year.
This is a hospital outpatient clinic packed with patients in face masks waiting for the turn. 2 weeks earlier than usual, Taiwan CDC has announced that Taiwan has entered its seasonal flu epidemic period.
Taiwan CDC hereby announces the official start of the epidemic period. Last week, there were more than 100,000 hospital visits for flu-like symptoms, and these cases met our alert threshold for emergency room visits. We expect winter influenza to peak over Spring Festival. This year, we had patients come in for summer flu all the way to November. There's been a nearly uninterrupted stream of cases all year round. As a rule, flu shots are administered only once a year, and their protection is limited. One way to bolster immunity is to get a vaccine that contains an adjuvant, which helps the body create more antibodies to the virus. That can extend the protective effects by 2 to 3 months.
This outbreak of Influenza A virus subtype H1N1 is most likely to affect the elderly and children, as well as adults aged 50 to 64. People 50 or older are advised to get vaccinated this season.
Generally speaking, the flu complication we see more often in cardiology is viral myositis. People with metabolic syndrome, older patients with chronic conditions, infants and young children have to pay close attention to their health.
After receiving a flu shot, the body takes 2 weeks to produce an immune response. Taiwan CDC is urging the public to get vaccinated by mid-January. Those who enter crowded spaces are advised to wear a mask and to regularly wash their hands.